Now, what Senator McCain has is called a glioblastoma, a common but fairly aggressive form of brain cancer. So joining us now to discuss the facts about this brain cancer is Dr. Nimesh Patel, a neurosurgeon at Methodist Health's Brain and Spine Institute. Thank you so much for joining us this afternoon.
Thank you for having me.
So glioblastoma sounds intimidating. Let's break down what exactly that is.
Yes. So a glioblastoma, what it is, it's a tumor from the brain itself.
Okay.
And it's aggressive brain tumor. It's malignant. And the way it spreads throughout the brain, and people describe it in forms of where you can drop a small amount of red paint into white paint, and the way it spreads is the way the red paint spreads throughout the white paint. Wow. You can't remove the whole thing.
Wow, so that makes it tricky. And I'm wondering, how would that manifest? What would be some of the symptoms that Senator McCain would have been experiencing?
Yeah, typically the way any tumor in the brain presents depends on what function, what part of the brain it is, and what function it disrupts. In Senator McCain's case, it was an incidental finding. He was complaining of some things of fatigue and some double vision and some just clarity, lack of clarity of thought. And so because of those things, an astute physician decided to get a picture of his brain, and that's where they discovered a large blood clot right above the left eye.
So now, once you've determined that there is a glioblastoma, what are the options for treating this type of cancer?
First, from a neurosurgeon's perspective, the best thing you can do is try to operate and remove as much as you can.
Okay.
After that, it is chemotherapy and radiation.
Sure. So we understand that we don't know all the details about Senator McCain's case exactly, but in your medical opinion, what is the prognosis here?
So, the average survival, and I'll say average survival, is about 12 to 14 months. Now, that means there are people that survive less, but there are definitely people that survive more than that. If there's one thing we know about Senator McCain, he didn't get the nickname Maverick just on a whim, right?
Absolutely.
So, yeah.
So even though he is a little bit older, he is around 70 years old, do you think this will present any added challenges? The other question is, how much does underlying health really play a role when you're trying to treat something or attack something like a glioblastoma?
It does. The prognosis of any type of brain tumor itself, age is the number one thing that does play into prognostic value, but also functionality. How was he doing before? And he was a functioning senator. So again, that lends to his name of being a maverick. So the jury's still out there. All I know can tell you is brain cancer has a fight on its hands. So.
All right. Well, we certainly wish him luck, and we thank you so much for joining us this afternoon to help us understand what exactly he's going through.